Seamus is in Dallas in Texas, and we talked to him there a few minutes ago. So it's early in the morning, and I want to thank Seamus for coming in at around 8 o'clock. It's a tough area to start talking about issues in data usage at that hour of the morning, but thanks indeed for doing that. And our second speaker then will be Carmel Heaney, and we'll say a few words on Carmel later. So just in relation to Seamus, and just to give you some background there, Dr. Seamus Dowling is Programme Chair and Lecturer in Cybersecurity at ATU, Lecturer and Researcher at ATU Mayo and University of Texas in Dallas. Seamus is also the co-founder, administrator and academic instructor of the Cisco Academy at ATU GMIT and a Fulbright Ireland TechImpact Scholar for 2021-2022. Seamus will speak on emerging issues in data usage. Dr. Seamus Dowling will join us from the University of Texas in Dallas, where he's a visiting Fulbright Scholar researching machine learning usage for IoT cybersecurity at University of Texas Data Security and Privacy Lab. Internet of Things and Internet of Medical Things provide the opportunity to deliver healthcare remotely in the community. It also has the potential to collect vast amounts of data that needs to be securely collated and ethically analysed. Seamus will briefly discuss the technical challenges in doing this, as well as introducing legislative and governance responsibilities for organisations in this space. I'd like to welcome from Dallas, Texas, Dr. Seamus Dowling. So you can.
Hi, George, and hi, everybody, and thanks very much for that invite and that introduction. I'm over here. It's early morning over here in Dallas. I'm just going to share out a few slides, not too long. It's not going to be a long lecture, but it's a very interesting arrangement that University of Texas would have with its partners and its funding opportunities. Certainly, it would have big organizations and industry on campus that they would link in with, such as Texas Instruments, such as AT&T. And the larger organizations are struggling actually to find graduates to work on R&D particularly, and because they can command very high salaries in the industry themselves in core cybersecurity roles. So a lot of the organizations fund colleges like University of Texas very, very well to perform the research for them. And by their own admission to industry, that is, they would argue that perhaps they lose a little bit of the control in doing so. But it's just the way the industry has kind of evolved. So, for example, the University of Texas is the second largest computer science department in America. And it brings in millions per year in funding, and it leverages that to really do some important research in there for the US Army, for the Navy, for Texas Instruments, etc. And some of the projects I've been working on and linking in with have been really, really fantastic, including launching satellites and looking at cybersecurity associated with satellite operations as well. So just very quickly, I'm just going to share a few slides. And as I say, because I've only got about 10 or 15 minutes here to talk, I'm going to limit it just to a number of bullet points here. So the first thing I'm going to talk about is actually Internet of Things and Internet of Medical Things themselves and the vulnerabilities associated with them. I'm going to go on and talk a little bit about data usage and governance, which is not just alone GDPR, but when it comes to cybersecurity, there are specific directives, law and legal frameworks that have to be adhered to. And I suppose, as George alluded to there in the introduction, we also have master's fellowship students. Carmel and I were involved in just interviewing there during the week. So we will have master's students lined up to start in September. So it would really be beneficial for the student and for some client organization to be able to leverage both the research and the students' time to be involved in some very meaningful work. So I suppose to start off, if anybody Googles or looks at what Internet of Medical Things looks like, invariably you're going to find some kind of an image like this where somebody is using a their tablet or their phone to be able to control all the various telemetries associated with medical devices. And we do that. We've already bought into that concept to some extent, insofar as we all have Fitbits, or some of us have smartwatches. And we willingly give that data into the cloud for some kind of analytical tool to be able to look and analyze that data and help us sleep better, or analyze the number of steps we take, etc. So we've already, the concept of this Internet of Medical Things already exists to some extent, but I suppose it really needs to kind of broaden out for it to be a much more meaningful implementation. And I suppose as we try and deliver healthcare more into the community, then the connections from cloud services to all the end devices associated with medical things needs to be much more comprehensive. And in my view, coming from a cybersecurity perspective, every dotted line that I see on this image over here, every dashed line, every communication line is itself an attack vector that is open for exploitation by threat groups. And that's kind of worrying, because there's been lots of known attacks on specifically targeting Internet of Things. And about 5 years ago, there was a large-scale distributed denial of service attack that targeted what was called a busy box operating system that was predominantly used on IoT, and that cyber attack was called Mirai. And whereas it's not too critical if that attack compromises maybe a street light, it turns on and off the street light. But if we're compromising end medical devices or the telemetry gathering, then that has much more implications. And I suppose if I want to kind of demonstrate some damn lies, statistics, depending on what report you look at. This one is just I brought up is the Deloitte Center for Health Solutions. There's 3 bullet points there that I just kind of put up just as the conversation pieces. The IoMT marketplace is estimated to be 158 billion, and it's going to grow, you can see, to 254 billion. The devices already deployed globally is somewhere in the region of 20 to 30 billion. Now, I imagine a lot of that has got to do with wearables. A lot of it got to do with the Fitbits that probably can be found in the back of somebody's drawer at this stage, and smartwatches and that kind of thing. But we are moving more, as I say, into deploying more complex medical devices into the community, such as ambulance services, such as remote monitoring, such as remote care. And just one statistic is healthcare companies who have already deployed IoMT. It's growing. It's into 60%, and there are some instances, even in Ireland, St. James's Hospital, for example, which is going much more down the road of rolling out Internet of Medical Things. I suppose any presentation wouldn't be without its dramatic headlines, and we have lots of cases. As I mentioned, the Mirai botnet targeted IoT specifically, but there are other vulnerabilities known in the area of Internet of Medical Things. And we have had cases whereby devices and very important and critical infrastructure in the area of medical devices, such as insulin pumps and infusion pumps, have been compromised, and arguments and lots of discussion around how we actually best secure Internet of Medical Things cyber attacks. And I suppose one of the protocols I'm just going to talk about now is something called Zigbee, and Zigbee is a known IoMT communicating protocol. And indeed, as part of a research a number of years ago, I actually wandered around. I have this sniffing device that it's able to capture traffic on what's called 802.15.4 communications channels. And I was able to wander around and pick up open or plain text data that was being sent around the Galway region. I won't specifically mention what organizations I went into, but they were using communication protocols such as this, and I was able to capture them, and they weren't encrypted, and they were pretty much open source plain text. So if I look at, I suppose I'm concentrating on the technical side of things initially. So if we look at the entire picture of what Internet of Medical Things might look like, and every one of these end devices is some kind of an IoMT sensor, then at a hardware level, we're looking at very small microcontrollers, Arduinos, Raspberries, Galileos. I'm working on Texas Instruments over here. And I suppose what sometimes these can be considered either full function devices or reduced function devices. And if it's reduced function devices, that means they don't have the footprint or the real estate to be able to implement robust encryption or authentication measures. And indeed, some protocols make it optional that they actually implement such robust encryption. So that's why I'm saying we could pick up open or plain text traffic on over the air. And some of those at the hardware level, the communication protocols, again, this is very technical. So for people who are working in this space, you will recognize a lot of the protocols such as IEEE 802.15.4. We know Bluetooth, Zigbee, LoRaWAN, any of the cellular networks such as 3G, 4G, 5G, or LTE, Wi-Fi, RFID, and Z-Wave. These protocols are all used to communicate information from the end device to some kind of a collecting gateway or a hub. And the comms itself, so they're just at a hardware level. The communication that needs to be stacked on the IoMT device as well might require anything from communication protocols, HTTPS, and then there's very specific ones associated with Internet of Things such as MQTT, CoAP, and then we need to implement some encoding on top of that, and maybe programming in the area of JSON or XML or data representation, and then we have to put in encryption on authentication. And so you can see that the small IoT or IoMT sensors all of a sudden need to be nearly more powerful than a normal computer because they have to implement all these communication protocols or robustness or encryption, etc. And then, of course, these devices have to be able to send information to the cloud so it can be analyzed. I put in here with an asterisk HL7, so people in this space would recognize the HL7 message format, globally adopted to be able to kind of communicate information. I put in some open source projects such as OpenHab, which is an open source smart home project. And of course, if we are looking at rolling out healthcare to the community, then we do need to have some kind of a smart home integration. Google Health are big in this space, as are Apple, as I've already mentioned. And I put an asterisk beside Microsoft's Health Vault because about 3 years ago, Microsoft scrapped their big project, which they had poured millions into, which was called Health Vault. And they felt they couldn't get the integration, they couldn't get the social buy-in to be able to implement a full integrated IoMT. There was too many challenges there. So that was an interesting kind of case study in its own right. And of course, all this traffic needs to be modeled or visualized and then perform some kind of data analytics and some kind of machine learning. And I suppose if I wanted to kind of bore everybody about what I'm working on over here, it's very much around the area of machine learning. And we're using a specific type of learning called federated learning, whereby the end devices themselves are responsible for doing the data analytics, which again puts more pressure on the actual the processing power associated with an IoMT sensor. So a lot of organizations might decide to say, right, let's just get the communication side of things. Let's get the data harvested and collected and sent. And we'll worry about all the other stuff towards the end, such as the machine learning or the analytics. We just need to collate the data and do something with it. And a lot of times, if you're working on a very small processing power, then maybe encryption and authentication is something that is kind of left towards the end of the development cycle. And I suppose that's what I'm working on over here with using some kind of machine learning that's small enough to be able to encrypt and secure the data before it's actually sent to the cloud or central hub, etc. And I'm moving off the technical side. I think you'd be glad to hear and look at some of the regulatory or legal frameworks. So we have two elements. In the EU, we have what's called the NIS directive. Now, I'm not even talking about GDPR or data protection acts or anything like that. I'm specifically talking about directives and frameworks that are purely for cybersecurity. So we have an EU NIS directive that's out there, and it's soon to be NIS 2. And that's a legal requirement, and it's in being NIS 2 is going through the final stages in the European Union. And in the US, they have what's called a NIS framework, which is voluntary, but it is required or mandatory if you're working with the government or you're engaged in any subcontracting with federal organizations. And if I just kind of bring up this big spiel associated with what the NIS directive is all about, it says to respond to an increased exposure of Europe to cyber threats, the NIS 2 directive now covers medium and large entities from more sectors that are critical for the economy and society. So really what they're looking at there is critical infrastructure. So, you know, communication services, digital services, wastewater, waste management, energy, etc. But I put it down here at the end. NIS 2 directive, it also covers more broadly the healthcare sectors, for example, by including medical device manufacturers. And the reason why I'm bringing this up is for this last point that I'm just displaying on screen now. Because the NIS 2 directive also strengthens cybersecurity requirements imposed on companies, addresses security of supply chains and supplier relationship. And this is the most critical element associated with what the NIS 2 directive is, and introduces accountability of top management for non-compliance with cybersecurity obligations. So if a company either gets hit by a ransomware and pays that ransomware, or gets hit by a ransomware and don't make their infrastructure more secure or more robust, then they are open to penalties. And so that NIS 2 directive, as I said, is going through the final stages, and it does have implications for anybody that is processing data or considering some kind of a cybersecurity element to their product. I suppose if I look at the voluntary framework, I'm going on to the next slide here. Which is very much more about compliance. So if you're looking at it, maybe something like the US NIS directive or NIS framework, which is voluntary, but you can go through the controls and the processes to show that you have got the paperwork by completing the various controls, and you demonstrated that you are regulatory compliant by doing so. And there's so many of them out there. And they are, you know, we might recognize ISO, for example, but specifically the NIS cybersecurity framework over on the left-hand side. There's other ones dedicated for credit cards, such as PCI. There's other ones for dedicated for healthcare, such as HIPAA. And then there's lots of other ones, such as CIS. And these are all compliance standards. And you can just fill these, you can actually complete these yourself. They're quite complicated piece of paperwork, but you can complete these and demonstrate that you are compliant. However, that's fine if you're able to do that. But with this NIS 2 directive, the EU directive that's coming in, you're going to have to kind of go another step further to demonstrate that you have made your organization more secure. So it's interesting times ahead when it comes to the governance of cybersecurity. And I suppose if you're kind of worried, thinking about, well, where do I start with all this? I suppose I'll give you one takeaway on this. And as I said, I haven't even mentioned GDPR. I'm not an expert on that, the UK's version of GDPR, the Data Protection Act. And over in the US, what we're looking at now is implementing an equivalent of GDPR, which is called the Washington Privacy Act. And that's because they don't have the equivalent of GDPR over here. It's very much voluntary, as I mentioned. But if I kind of give you one takeaway from this, is there is a product called Microsoft Purview. You can try it for free, and it's built on the Azure platform, so a lot of people might already be on Azure, but it's quite complex, quite complicated. There is a link there if you want to go and check it out. And if you do scroll down through this, you'll come across really good documentation associated with, and I just highlighted here, if your organization needs to comply with legal or regulatory standards, start here to learn about compliance using Microsoft Purview. Obviously, it's infrastructure as a service using Azure, and I suppose Purview can be considered software as a service. So just like any of these cloud products, the more you use it, the more you pay for it. But it does give you a free trial for working on it, and great documentation. I recommend just going away and having a read through some of these just to give you an idea of what that might be. And I suppose the last thing I want to talk about is this, as George mentioned, and Carmel will probably talk about as well, is our Master's Fellowship. As I mentioned, we already interviewed for a student, for an applicants for this, and we've somebody going forward for it. It'll probably a case that will start in September, October. And they are going to look at the whole landscape associated with IoMT in Ireland and how much is being deployed and cybersecurity concerns associated with that. So they would be bringing in everything associated with what I've just talked about there from the technical side of things and also from the legal side of things as well, maybe regulatory and governance frameworks. And if it could be really beneficial for a client, IHOP client or organization to be able to kind of work with a student like this, or because it would be brilliant exposure and research for the student, and a client would also get the benefit of actually having a student work on specific concept, as it's mentioned, for example, maybe some of the governance and legal frameworks associated with that. And that is it. So I'm just going to stop sharing my screen. Thanks very much, everybody. Thanks, George and Maria and Tarlock and Hannah, for everybody for organising and inviting me along for this.
Great, and thanks, Seamus. Thanks indeed. And I should say just that to confirm for everyone that this event is being recorded, so you'll be able to get it on our YouTube channels. Indeed, for some of the people that couldn't come today, or for there's more people online. So thanks indeed, Seamus, from coming in all the way from Dallas and giving us that update. Like, you covered critical things like the IoT and the Internet of Medical Things, and indeed some points on cyber attacks and the sort of policies around that. And then, you know, your area was technical, looking at that initially, and then you moved on to the sort of regulations and compliance, and then finally on the Master's Fellowship as a sort of an example of maybe of what we're trying to get to here. So the second part of the update today is moving more towards how we might implement some of that merging, if you like, between the academic people and the iHub clients that are here. So the topic that Carmel is going to speak about is engaging with and optimizing early academic partnerships. And I think that's really what we're trying to look at. And I suppose this is probably the first of two events. We do plan to run another follow-up event in October, sort of follow on from today. And indeed, anyone that's looking to, you know, has queries, they can email Carmel or Seamus directly and just CC us in the iHub here, and we will follow up. So I want to welcome Carmel. Carmel is here present in the iHub, which is great. And Dr. Carmel Heaney is a senior lecturer and researcher at ATU Mayo. Carmel has been working in the health research field since 2004. She has significant experience in research design and project management in both clinical and medtech domains. An awardee of a Health Service Research Training Fellowship from the Health Research Board, Carmel completed her PhD in Public Health Medicine and Epidemiology in 2012. Her research experience spans both the hospital and community settings, representing collaborations between academic and industry research groups. Carmel has experience in fund procurement, study design, project management, and scientific writing. She has significant experience in research and funding applications in this space, and has published a number of papers on associated topics in high-level international peer-reviewed journals. Carmel has a particular interest in population health, chronic illness management, and connected health in this context, and welcomes opportunities to collaborate and engage with community and industry stakeholders interested in project work or this research. Carmel will speak this evening on engaging with and optimizing early academic partnerships. Dr. Carmel Heaney will provide attendees with an insight into how industry-university engagement may be worth exploring, the types of research engagement, and how to critically start these conversations. I'd like now to welcome Carmel to the podium.
Thank you, George, and thanks to the iHubs for having me here today. I'm going to just pick up on where Seamus left off. I suppose Seamus is has spoken about a particular angle that's very relevant to digital health and is increasingly pertinent, that idea of security. But there are multiple dimensions that inform quality digital health provision and digital health information advancing. And that is one angle. And I'll talk a little bit about thinking outside the box for innovation companies and how you can engage with academic institutions to that end. When I talk about engaging with and optimising early academic partnerships, I'm going to speak a little bit about what motivates the university to look out for and engage with innovation partners, and why that is something that the Innovation Hub companies should think about. Where are the benefits for you? There needs to be benefits. What types of relationships can be fostered, and how to go about initiating engagement with institutes such as the ATU. So why universities engage with industry? Well, firstly, we need to take the macro remit of any higher education institution. And our ATU spans a very large geographical region, approximately the size of Wales. And our ultimate mandate is to support regional need. And that's through education, innovation, and research, and support regional growth in doing that. It's to retain expertise in the area and provide pathways for companies, for researchers, for educators to develop sound collaborations and really punch with the best in terms of that. And we've done that in some sectors internationally, but we can expand that area. We've been very successful in medtech in this area down the Western Seaboard, and that has come from early industry collaboration and research integrated with education solutions. We want to expand that into other areas, including digital health. We also want a motivator from a university point of view is that our research is informed by need and experience. So we want to be collaborating with innovators and next generation solutions. If that's for both research output, but also our educational outputs, those collaborations and having those conversations with industry experts is really important to inform our students and provide solid, meaningful pathways for students coming out of the ATU. The translational research pathway is really important. There are lots of ideas all around us every day, but have we pathways to mobilise those into solid outputs, and can we retain those in our region? And access to unique resources. So many companies are working with data, solutions, innovation, that the universities are keen to be part of and to access and trial and test those solutions. And the joint pursuit of opportunities, and then developing alumni connections and supporting alumni. And I suppose in terms of metrics, a very important output for ATU staff and university staff across the country is impact. And we evidence that by partnerships, by impactful collaborations, by delivering good quality research, by gaining grant funding, and by publication. So there are a lot of motivators there on the university side. And to look at, what's in it for the industry. Why would industry come in and collaborate? Can you hear me a bit better there now? Well, the innovative ideas. So often industry, or especially startups and early stage companies, are coming forward with innovative ideas, but they don't have the capacity or manpower to expand those ideas rapidly. And sometimes getting more heads around the table can lead to conversations and taking things to new levels more rapidly. The other thing that's important is that independent validation of solutions. So whether historically that's drugs or digital innovation or whatever your innovative solution is, it might be a new process, a new system. It is important to test that independently and get it validated. And obviously the universities have a core group of people that are well primed to do that. Access to intellectual property, the network access and expansion. So that builds upon the point I made last, that the importance of networking in. It's very easy to be in a silo in an iHub, in your office in the iHub, but actually equally it's easy to be in a silo in a large academic institution, and sometimes that isn't realised from the outside. The access to funding streams, and we're seeing increasingly that grants coming across email to us are looking for co-design. They're looking for collaboration. It's not one person designing a project and going with it. They want to see a few heads around the table, and we know that that is more impactful. It will deliver better bang for buck back to the funding body. Okay, so, and then expansion of working groups. So startup companies are obviously tight on resource. You might have 2 people in the startup initially, then a third, and it can be quite difficult to find the funds to expand the working team. So early collaboration and maybe getting research students on board, or an academic team or scientific team around the solution being created, just offers more back to that company. And again, the motivation, the joint pursuit of opportunities. When we look at this issue of mutuality, again, the working in silos is what we want to avoid. We have expertise all around us. We have it in the iHubs, we have it in the different departments across the ATU, and it's to find a way to connect the right people to each other. You know, there is no doubt that large talent pool is there on the doorstep. The opportunity to co-design is very powerful. And sometimes when we're maybe in digital health, we're looking at a particular app in a particular disease, it may not be an academic partner in that disease area you want. Maybe it's someone like what Seamus has talked about, that you want the privacy and security side, or maybe it's the software side. So it's not as linear as it can feel when you're starting out, that maybe the person you want to network is tangential to what you're doing, but will bring it all together more quickly. The grant funding opportunities are really important. Okay, I've mentioned the co-design, the potential to get MSc students to work on projects and mobilise what you're trying to deliver as a small startup company in an iHub, but equally the ATU gets opportunity to put more students through in very relevant, timely research topics. And some of those have the potential to advance to PhD level as well. And there are many other reasons why one would engage. The types of relationships, you may be just looking for some consultation, you know, some small inputs into project design or statistical analysis. You may be looking for larger contracted research. Maybe co-creation of new solutions. You're developing one solution, but you're seeing a potential fit with something else, but don't have in-house expertise. Come in and talk to someone in the institute or in the ATU and see where that could be brought to next. I've talked about the evaluation contracts or test bed studies, looking at the effectiveness of it, maybe technology, a hard tangible product or a service. Membership of research clusters. So we're birthing research clusters across the ATU all of the time. And as part of becoming a university, this is going to be a growth area for us. So when you look up our website and see research clusters in particular areas, more will be coming on stream in time once the internal system is organised in that way. Obviously, many of you that are already in the iHubs, you're availing of the space and incubation, but some of you online today aren't direct iHub clients, you're working in other areas, and that's another offering that's there across the ATU. And then strategic partnerships. And this is what this is about. You know, today we're addressing maybe early ideas, small companies, but as you grow, we can develop out strategic partnerships in larger areas. In terms of the ATU itself, I'll just speak broadly for a minute. There are a lot of very research active groups at the ATU, and our institutes independently, before we formed an ATU, had research clusters. Now they're all coming together. So across the counties within the ATU, there are a lot of research groups, and they cross a lot of different disciplinary areas. So as I said, you don't have to have this direct thematic alignment to your product our output, it may be reaching into a different cluster for a different element of the solution. So those, I won't go into all the areas today because they are quite broad and evolving, but there's more information on the ATU website on that. But I just want to bring to your attention, in addition to the defined research clusters and research centres, outside of that, there are other academics with a lot of expertise, subject matter expertise in particular areas. So if you look up the ATU and don't see a particular cluster formed or a particular research centre, don't discount still reaching out and looking for individuals with expertise, because we're still mapping and growing in that area, but they do exist. And the other thing to bring to your attention in the context of health is that the ATU departments have very well established clinical relationships with clinical providers, both public and private. And you know, many of those are quite research active and open to conversations on research engagement. So again, by coming in and speaking to us, we may be able to signpost you and create channels of communication for you in that sense. Because this is a digital health event, there's one research centre I'm going to draw your attention to. Our thematic area is digital health, and in ATU Mayo we have a centre called the EPIC Research Centre, and EPIC stands for Environmental, Person-Centred, Integrated and Connected, and it's a centre for research and community engagement. And our focus there is interdisciplinary research. It's that idea that most research projects are not linear, and a lot of grant funding opportunities are looking for that collaboration, integrated approach. And that's what we aim to do. So we're focused on applied and collaborative health and community-based research. We've quite a number of academics that are engaged there with interest in exploring areas of digital health, but other areas. But particular to digital health, we have the angles of public health knowledge, chronic illness, healthcare analytics or statistics, healthcare management, connected health and public and health policy. And that group are interested in looking at co-collaboration on projects, on grant funding, research project co-design, partnerships for designing research fellowships. They can be sponsored by companies, you know, where you might have a staff member you want to take on, but what will keep them with you is engaging them in a research master's, and you might want to sponsor that and have co-design on that. But equally, there are grant opportunities to come across our desk that are looking for either co-funding or they're exclusively funded by particular bodies, but they want us as academics to partner with industry. And they're areas that I think there's great potential to collaborate on. To that end, and I'm nearly finished now, it's where do I start? So some of our audience are from the iHubs today. Some of our audience are my academic colleagues who are keen to engage in research. And I suppose it brings back to the conversation when Seamus and I went to Georgia initially. It was on the back of seeing research funding opportunities come in for these master's fellowships. And you know, Seamus and I realised in conversation we didn't know what was in our iHubs and what industries were there. We knew about medtech, but there were other areas we didn't know about, and we felt that if we had had earlier conversations and ourselves reached out earlier, as the grant fund opportunities come along, we would be able to bounce quicker and pick up a phone more quickly and get conversations going around project design. So our advice would be, where do we start? It's proactively reaching out on both sides, be it academic, be it large industry out there. I know we have some HSE colleagues online, or the iHubs. Reach out, you know, who is doing what where, who's interested in what do we need as from an industry point of view, what solutions can individual academics or cluster centres offer industry. And then the other, in those early conversations, it's about relationship building and finding people you think that's someone I'd really like to work with. You know, seeing the synergy where your organisation is getting satisfaction out of what's being proposed and that there's alignment to the advancing your own business strategy, and that there's a sense of commitment. Commitment's really important, and collaborations do take time and investment and a lot of conversation before things actually happen, but that's part of everything. So be sure that both parties are committed to making it work and getting a mutual win-win scenario. And I suppose the take-home message is no conversation happens too early in this space. You may open a door to someone you already know, and you mightn't have the solution, but you might be able to signpost the person. And that's particularly for those of us working within the ATU. If the iHub client companies reach out and you can't help them directly, can you signpost them onwards? Get conversation going, look to be connected, build relationships, know who you'd like to work with, and develop project pipelines. This is really important. Even though budgets can be tight and small, both internally and externally, we should have an aspirational roadmap of where we want to bring our work, both academically and from a research point of view. So have we wish lists, and include targets, but also tangential projects. For example, security mightn't be on your immediate radar if you're developing digital innovation, but it's going to come into the framework somewhere along the way for you as you navigate the research pathway. So do you need support on that? And there are other angles to think about. So think outside the box. What information or research would be of benefit in establishing a need for your innovation? Even does the market need to be scoped, for example? You might be relying on international evidence. Is there Irish evidence? Is there European evidence? What would be scoped out in that sense, and approach the academic institutions for this. The timelines for grant funding can be very tight, and they're not the ideal time for the introductions. It's the early conversations, putting down little markers, getting everyone thinking, and then as we see opportunities come up, we know who to pick up a phone to and say, look, we talked about this before, can we pick it up again? So they're just, as I said, a bite-sized idea of how we can start engagement and conversations. And I just want to thank you for your attention, and thank George and Maria at the ATU iHubs for the invitation to speak to you today.
That's great. That's great, Carmel. Thanks very much. It was great to get the update there. You looked at areas like, why should we engage with the research, and then how should we engage, and indeed, what are the joint benefits, for both iHub clients and for academia that this, in this process. And then you talked about the EPIC Centre, which is very interesting area, and the whole area of digital health. And I think all of the, the areas, the sub areas that you brought out there, as I look at the clients in the iHub, there's a whole load of collaboration that I'm convinced we could get. Like all the areas that you mentioned, a lot of our device companies even now, where they were traditionally in vitro devices, there's a lot of sensors and all that stuff being built around them. So the IoT, the Internet of Medical Things, as Seamus alluded to earlier, I think there's very, very significant opportunities there. And then you finished off with, the reach out, and I think that's the key thing. And the point is to start the conversations. And as I said earlier, this is the first of two of these that we'll do. So what we want people to do is to indicate to us what area they'd like to do some potential research in. They can email Seamus and Carmel directly. They can email ourselves in the iHub in Galway or in Mayo, and just give us an indication of what the areas are. We then need to start some early engagement, some discussions, maybe throw in a bit of coffee. These are the important things that we need to do to get that going. And really, the aim here and the goal here is that we would like to bring additional talent to the startups that we have in the ATU iHubs. And now indeed we have 4 iHubs going forward when we include Sligo Centre and we include Letterkenny. So there's loads and loads of opportunities there. And we would love to be able to bring master's students and even PhD students and bring that talent and expertise to support the clients. So I know we won't get a lot of questions or anything today, because this was really just a primer event to float out the idea, to say that we're here. As Carmel said, when herself and Seamus saw the sort of presentation and looked at what's happening in the hubs, now we have that platform available. We have that opportunity to make that engagement, and the beneficiaries will be the clients themselves who engage in that, and the ATU. So I'd like to finish off at that, and before I do, I just want to thank a few people. First and foremost, I want to thank Seamus and Carmel, because without them we wouldn't have the event today. I think there's a lot of food for thought there, and I think there's real opportunities for engagement. Secondly, I want to thank Maria in Mayo iHub for actually facilitating the early discussions, because Carmel and Seamus were based in Mayo and we had the discussions there. And finally, I just want to thank my own team here of Turlock and Hannah and Mary in relation to helping to put on the event today. It's very important that we do this, and we're really looking forward to the follow-up. So email us, let us know, and we will work on these with you for the benefit of all. Thank you very much.